Care is changing the foster care system in New York's North Country this morning. This new approach keeps kids with people they know who might not be family. Our Kelly O'Brien finds out how this type of care is helping kids in crisis.
I became a kinship caregiver 24 years ago.
It's the call you'll never forget.
With my oldest granddaughter, and then 6 years later, I got 2 more of my granddaughters.
A little over 3 years ago, I got a phone call, and my granddaughter ended up coming to live with us.
When someone you love needs a safe space to call home.
I'm not going into the personal situation too much here, but she ended up with us for almost 3 years.
But it can be hard, especially when caring for your grandchild requires sacrificing your relationship with your own kid.
That was the hardest part, having to cut those ties, because in our situation where we were, there was no way to work that out. So I actually lost that connection with my daughter in order to take care of the 3 daughters that she had.
This is a story known all too well in the North Country. Family members or close-knit friends or neighbors stepping up to take in kids in crisis.
Research shows that kinship care actually continues to provide the child with connection to their family of origin, so it helps them to feel less separate from their family, less disrupted from their family, and that connection has shown that they actually have better outcomes.
There are many reasons why a child may need to be placed with kin: substance or alcohol abuse, mental health troubles, deployment, death. The list goes on. The length of each placement varies case by case. This past September, New York State started the Family First Prevention Services Act, its take on the federal program that places children with relatives or someone close to the child before looking at foster care.
We redesigned our entire services unit.
At the Department of Social Services in Plattsburgh, they're in charge of finding the placements for children.
We got more creative on how to find people. We're not looking at traditional relatives the way we've always looked at mom, dad, cousins, aunts, uncles, that kind of thing. We're really looking at who are their supports, who are their resources, who are they comfortable with, both parents and the children.
So before children are removed from their home, those questions get asked in case kinship care is needed. That helps caseworkers identify an upwards of 30 adults who are ready to take in a child at a moment's notice.
And I think our numbers speak to, the increase from 12% to 43% of our placements being kinship placements. It speaks to our tenacity in going after and finding those relatives.
After the child is placed, they may be referred to the Child Care Coordinating Council of the North Country, which connects caregivers to services.
Tried to keep the connections going with kinship caregivers in between being funded, because we recognize how this population really needs support.
They've been working with kinship caregivers over the last 10 years and will help families at any income get the funds that are available to them.
Oftentimes, kinship caregivers don't realize that, and they just sort of absorb the costs.
Despite all the help, these grandmothers say returning to parenting is very hard.
They have to live through it, the parents have to live through it, and you have to live through it. And you just support them the best that you can, and it's not easy. It's not easy any way you look at it.
When you're younger and you take on this situation, it's a little bit different, but everything has changed for you. By the time you're 60, 65, 70 years old and you're suddenly responsible for a child, it's a big change.
Reunification is the biggest goal of any placement. For Geddes, her granddaughter went back to her mother in May. Martineau still has 1 granddaughter. The other 2 are living with their father. Both grandmas say they could not help those kids without community support.
Not everybody knows everything, so we kind of feed off of each other and learn from each other and help each other.
Oh, I've learned so much over the last 3 years, and it's hard to tell where it all came from, because you just think when you're older you're going to know everything. No, that's when you find out you know nothing.
Kelly O'Brien, Channel 3 News.